It's time for the big three. Three stop.
Welcome, everybody.
Thank you. Thank you.
Good to see y'all in the space. Welcome. I'm Katie Trazo. I'm with the Center for Food Systems and Community Transformation, and really excited to be offering a learning exchange with the Roanoke Food Shed Network. We're focusing today on food as medicine, and we're going to hear from folks in our region doing this work. Maureen McNamara Best, Rachel Burks, and Sabrina Simmons. So we're curious who's in the space with us today. So if you're willing to write in the chat where you're tuning in from to see who's joining us in this conversation. Lovely. We got some folks from the eastern part of the state, the northern part of the state up in Leesburg, nearby in Rocky Mount, Northern Neck, so folks on the coast. We got some folks right here in the community in Roanoke with Carilion. Welcome from Iowa, Christina. It's lovely to have you. We got some folks from Virginia Cooperative Extension and over from the University of Kentucky. Small Farm Outreach Program at Virginia State. Wow, this is really exciting to see who's joining us in the space today. Seems like we got some good coverage from folks in the region and outside the region. Wonderful. With that, I'm just going to do a couple technical logistics slide. Invite you all to continue using the chat feature for any comments you have or any questions you have while our speakers are sharing today. We will have an opportunity with the last 10 minutes to have some Q&A, so encourage you to write any questions you have in the chat. And later as well, there will be opportunities if folks want to ask questions as well. We ask everybody to please keep your line muted. That'll help us make sure we can hear our speakers well today. And we also want to note that closed captions are available, and you can access those by clicking the three dots and the More button on your Zoom pane, and you'd be able to get the closed captions that way. We are currently recording, and we will also be able to share that out on the Roanoke Food Shed Network website and YouTube, and we can share a copy of that with our participants today and the folks who registered. So we want to let you know that that's available. And we have Kim Nowalny in the background. If you're having any technical difficulties, you can message her in the chat or email her at nowalny@vt.edu. And Kim's putting some of this stuff in the chat now, so you can have that for a record later. So those are just a few technical logistics. And we want to just briefly share about the Roanoke Food Shed Network before we pass it off to our speakers. And so I'm going to pass it to our director, Maureen McGonigal, so that she can share with you all.
Thanks, Katie. Hi, everybody. My name is Maureen. I also go by Mo McGonigal. I'm director of the Roanoke Food Shed Network, and just really, really excited to be here with all of you and to showcase a really amazing initiative partnership that's taken off in Southwest Virginia. But before that, a little context about the Roanoke Food Shed Network. We are a regional food systems collaborative based in Roanoke region of Southwest Virginia. You can see kind of our 7-county region there. And our goal is really to build connection and resilience and equity across the Roanoke regional food system through collaborative efforts from supporting farm viability to supporting healthy food access and kind of everything in between. So we bring partners together through a lot of convening, shared learning opportunities like this one, farm tours, and kind of shared communications among many other efforts. So that's just a taste of what we do. We have a listserv and some communications, Facebook, Instagram, so feel free to reach out and stay connected. I I can get you added to our listserv if you send me an email. So thank you so much. I'll leave it at that and pass it back to Katie.
Awesome. Thanks, Maureen. And so, as Maureen said, we do learning exchanges with our community. Sometimes we hear from folks outside of the region. Sometimes we hear about work that's happening in our region. And today we're going to get to hear about the food is medicine work that folks who are partners of the Roanoke Food Shed Network are leading. So we'll hear from Maureen McNamara Best, who's the executive director of LEAP, which is also known as the Local Environmental Agriculture Project. We'll hear from Rachel Burks, who's a program consultant with Carilion Clinic, Community Health and Development. And we'll also hear from Sabrina Simons, who's the agency relations coordinator with Feeding Southwest Virginia. So they'll have a collaborative presentation to share with you what they've been doing around food as medicine. And they'll each introduce themselves as they pass along the baton. And so with that, I will pass it to Maureen Best, and we'll spotlight you. And we will also have you share your screen too. Stop share.
Thank you all. Can everyone see this?
Yeah, that looks great, Maureen.
Awesome. Well, thanks for having us. My name is Maureen McNamara Best. I'm the executive director of LEAP in Roanoke, Virginia. So we are a nonprofit looking at the whole food system to support farmers, keep farmers farming, and we do a number of food access and food distribution programs, really looking at the intersection between food access and food production. And one of the programs that we've been doing for a number of years in partnership, we will talk about today. So the Southwest Virginia Produce Prescription Program is highly collaborative. We work very closely, LEAP, Carilion, Virginia Fresh Match, Radford, and Feeding Southwest, the 5 main organizations, work really closely together both to design this, to implement it, and to continue to evaluate and make improvements. Before we really launch into Southwest PRX, I do want to talk a little bit about food as medicine. Food as medicine is something that you hear the terminology and you may be super familiar with it or maybe have just heard the name. Food as medicine is still, I would say, relatively new, and it's also very, very old. So it's looking at how what's the intersection between food and health. And so there's population level programs and policies, looking at what are we really doing as a whole community or a whole country. And then you also have nutrition security programs, which most of us are familiar with, school meals, SNAP, WIC. And those are kind of the baseline of food as medicine. When you get into what people often talk about with food as medicine, it's really those top 3. So produce prescription programs, medically tailored groceries, and medically tailored meals, where there's an explicit connection from a healthcare practitioner and food. So really looking at how food can be used as a way to improve health at the individual level. And also a lot of times it's also improving health at the community level. So nutrition security programs, population level, that's really looking at prevention, and food as medicine, the upper tier, it's more looking at it from a treatment perspective. So the 3 main food as medicine interventions are medically tailored groceries, which looks at, it's usually whole produce and also shelf stable, specific dietitian recommended diet for a specific health condition. And then there's also produce prescriptions, which we'll talk about the work that we're doing in that space next, and then also medically tailored meals. So across Virginia, there are programs that are working in all 3 of these. So if you're curious, this just gives a little bit more language and terminology to think about and find out about what may be happening in your own community or nearby. So a little bit about the history of Southwest Produce Prescription. We as many communities do, the Carilion works and does a community health assessment. So in response to the community health assessment in 2015, we started as a collaborative to pilot a produce prescription program. And it was originally designed in partnership with the LEAP mobile market. And so we had a cohort group model where the LEAP mobile market went to 3 clinics, and then the group would come together with nutrition education and then go and shop at the mobile market. And some of the challenges that we found with that was that it was really hard to scale. And so we continue to make adjustments to the program design over the next 6 or 7 years. And then in 2022 and 2023, as a community, we really came together to do a systems mapping and to redesign the produce prescription program and basing it on what are our existing strengths and resources at the community, and then how do we tie them together. So we piloted our redesign and then applied for and received a federal GSNP produce prescription grant in 2024, and we just finished up our first year under the new expansion, and we will share those results today and then also make them available. And so the biggest things to really undermine that I'd like to underline is that we've always looked at it from a health and a food perspective. What are the roles of the health practitioners? What are the roles of really the food system, the food infrastructure, and then how do we seamlessly, or as seamless as possible, connect those so that we can really lift up and continue to invest in the strengths of our community. And I will turn it over to Sabrina to talk a little bit more specifically about how the program is working.
Thank you, Maureen. Hi, everyone. Sabrina Simons, the Agency Relations Coordinator for Health Partnerships at Feeding Southwest Virginia. In my role, I work exclusively, with 16 unique healthcare partners across our 26 county, 9-city region to support and expand our food as medicine initiatives. And I source the healthy food that fuels 22 different programs, everything from shelf-stable items for on-site pantries to every fresh produce for nutrition education workshops to medically tailored food boxes for patients with specific health needs. My work focuses on helping and supporting our healthcare partners integrate nutrition into care so we can improve health outcomes, nutritious food access, and security across Southwest Virginia. So what is Southwest Virginia Produce Prescription Program and how it works? It's a medical intervention for adult Medicaid patients with diagnosis of type 2 diabetes, prediabetes, and/or hypertension. A produce prescription program helps patients with diet-related health risks and challenges accessing the nutritious foods and encourages to eat more and giving them access to eat more fresh fruits and vegetables. And this is made possible when healthcare practitioners are able to refer their eligible patients into the program, and the patient agrees to participate. As you can see, the program includes 2 key interventions that work together: the prescription for fresh produce that is redeemed for the free fruits and vegetables, and participation in the nutrition education, which is for over 6 months. And the fruits and vegetables, they do receive some in person at the classes, at the nutrition education classes, and then they also retail, through food retail. And then here, as Maureen mentioned, all the key partners and organizations in the Southwest Produce Prescription Program, and you can see their roles listed underneath. LEAP with Project Management and Food Systems, Carilion Clinic, our healthcare provision and education, Virginia Fresh Match, which is our support for our prescription redemption outlets, Radford University Evaluation, Feeding Southwest Virginia in-person produce and partner pantries, and then we all are doing data collection and reporting. And then the food side of the Southwest Virginia Produce Prescription Program, as mentioned, fresh fruits and vegetables for the household. This comes in at a value of $15 for the patient and each household member for a week. So the patient themselves and all of their household members get a $15 value of fresh produce per week. And the fresh produce at the in-person class, we start off with more common varieties and those more ready-to-eat produce items. And then as the curricula and the classes progress, we expand to some new items. They're getting lessons and so forth within the curriculum on how to prep and incorporate it into their meals and their daily routine. And so we expand to some new items, and then we work with regional produce distributors and some partner pantries in the area to provide this produce. And then, as I mentioned, for the outlets, they receive the vouchers, the fresh produce bucks, and they can use these at retail outlets that are locally owned stores, farmers markets, and farm stands, and which are they are consistently making their stocks available with the beautiful fresh produce from April through November, and training their staff to accept the fresh produce bucks as the payment. So we are able to introduce participants to food and community resources that support long-term behavior change. And uniquely in year one, one of our cohorts was actually at one of our partner pantries. So those participants were able to see firsthand of some of the community resources that are available, which is really important in this work. And I'll pass it over to Rachel.
Thanks, Sabrina. Hi, everyone. I'm Rachel Burks, Program Consultant with Carilion Clinic Community Health and Development. And in my role, I support several key projects for our organization to address community health needs and healthcare equity related to chronic disease. And one of those projects, of course, is the Southwest Virginia Produce Prescription Program. So we just heard from the food side what produce prescription looks like in Southwest PRX. So what does the medicine side look like? And I'd like to frame the medicine side from the perspective of the patient. The patient experience that you see on the screen is made possible by aligning Southwest Virginia produce prescription as much as possible with our existing systems in our healthcare system, and of course the community food system. So some of this I will mention as we go, but really wanting to focus in on the patient and what they're experiencing. So what is it like for a patient participating in Southwest PRX? The patient experience begins when their healthcare practitioner sees them, determines that they're eligible for the program, and then they place a referral for Southwest PRX in the medical record, so within Epic. They're also documenting the patient's biometrics within the medical record, just as they would with any appointment. So looking at blood pressure, weight, if they have diabetes or prediabetes, they're documenting that hemoglobin A1C. Once the referral is placed, the patient will then receive a phone call with more information. So the provider doesn't have all of the schedule details. There's just so much that's happening with the program that those details are provided later. So we call the patient with more information, we answer their questions, and then if the patient decides to move forward with the program, they are scheduled for the program. So once they're scheduled, they start their participation by attending their first class. At that first class session, they officially kind of enroll in the program. They participate in a great orientation to the program, and they receive program supplies, which include some cooking tools, a participant guide or workbook, and I believe that might be about it, but apologies if I'm forgetting something. So after that first session, they have kind of the bulk of their classes. They have 8 full plate living nutrition classes that they attend. And then the full plate living curriculum, it is certified by the American College of Lifestyle Medicine, and it's developed by Ardmore Institute of Health, and it's aligned with our lifestyle medicine clinic and the education that they're providing to patients. We also this year will have 2 cooking classes for patients to participate in. And then during their participation, the patients have 2 main ways that they access the fresh produce. So again, they take home fresh fruits and vegetables from their classes, which are provided by Feeding Southwest Virginia and the partner pantries. And then they redeem their fresh produce bucks at participating outlets. After the 6 months, or when the 6 months is over for their participation, they attend their final class to explore next steps on their health journey. They take a survey. They have the option to participate in focus groups, and they see their healthcare practitioner to follow up on their health and how things are going. Next slide. Okay, so where we are now, and some of this was already mentioned, we have wrapped up the first year of implementation for the 3-year USDA grant. In year 1, we partnered with 3 clinics, 2 in Roanoke and 1 in Floyd, and we filled 5 cohorts of participants with 37 patients completing the program. We've expanded now to Carilion primary care clinics in Rocky Mount and a few additional locations in the New River Valley. And we're now in the preparation phase and actively receiving referrals for year 2. So the program is meant to begin annually in the spring, so around April or May. That implementation phase is for 6 months, and we wrap up in the fall. We do our evaluations continuously, but there's kind of a dedicated period in the fall and the winter where we're really working to improve processes, and looking at the data from year 1 so that we can improve for the next year. So a huge piece of this work is the process improvement. So Radford University is leading a formal process evaluation that includes participant focus groups, a provider survey, feedback from the health educators who are teaching the nutrition classes. And they are using, you can see on your screen here, the REAIM and PRISM frameworks, looking at both pre-implementation and post-implementation through those frameworks. So they're really providing a systematic and structured way to improve our processes. And we work to improve processes in real time. So we're always trying to tweak as we go, if we can, to respond to feedback or challenges that we might be facing, both on the implementation side and on the patient experience side. And then, of course, so the year 1 data, both the process data and the outcome data has really informed the model that was presented just a minute ago of the patient experience. So that patient experience was for year 2. It's very similar to year 1, so nothing has drastically changed. You know, it's a 6-month program. We have the same core education that's happening, the same dosage of the intervention or the produce prescription, but we've made some improvements to the program based on the data that we collected and evaluated. And then for our outcome evaluation, the key metrics that we're tracking include what you see on your screen. So participant blood pressure, weight, hemoglobin A1C, food insecurity, fruit and vegetable intake, and healthcare utilization. We're also looking at the fresh produce value that is provided and what portion of that is redeemed. So although healthcare utilization takes longer to assess, we are pleased to share outcome evaluation results from year 1 with you today. So out of the 37 patients who participated in SWPRx in year 1, 28 patients participated in research. And the data on the screen largely reflects the results from those 28 participants or patients. So participants increased fruit and vegetable intake by an average of over 1/2 cup a day, which is significant for a dietary improvement. So 1/2 cup is a serving, a full serving of fruits and vegetables. So that was a meaningful change, and that improvement was statistically significant. 54% of our participants experienced improved food security. And we did find a statistically significant improvement in food insecurity scores from pre to post based on survey results. Across all of the 37 program participants, more than $33,000 worth of fresh produce was taken home. And we experienced an 87% redemption rate for the prescriptions, which is really quite high for a produce prescription program. We were very pleased that the patients were able to connect so well to the food outlets and to the produce provided at the classes. We also saw some improvements in health, particularly diabetes control, although we really need more patients and more data to reach statistical significance. But about 2/3 of our participants in year 1 with type 2 diabetes did see a reduction in their hemoglobin A1C, indicating better glucose management. And the participants with type 2 diabetes reduced their hemoglobin A1C by 0.6 percentage points on average. And then finally, we saw improvements in well-being and satisfaction. So 2/3 of participants had higher levels of well-being and life satisfaction post-program compared to pre-program. And 96, an overwhelming majority, 96% of participants rated their experience in the program as positive or very positive. Next slide. And then here are some wonderful quotes that were collected in the surveys and focus groups directly from participants. One said, "I got hooked on vegetables." We had a lot of folks talking about how the program really benefited their whole household. So it was a great benefit, not only to me, but also my family. We had patients who said they were eating together more as a family and that it was important for their children and others in their household as well. One patient talking about the produce provided by Feeding Southwest Virginia on site said, "They gave us some that I would not buy on my own. It taught me about different fruits and vegetables that are good for me." So having that on-site produce was helpful in trying new things and important for that patient. The social connections in this group-based model of the intervention were also found to be pretty important. So patients said the group bonded as if we were family, and we have become friends outside of the group. There were a lot of comments about the cost, the rising cost of food and how difficult things were, and that this program really helped alleviate some of those financial stressors. So it helped feed me and my household as the cost of fruits and veggies are high and goes up weekly. We had raving reviews about our health educators who were teaching the classes. One participant said, "I took all 12 classes and learned so much that I didn't know that I can use in my new healthy lifestyle. The teacher was excellent." And this is a survey response that, the 4 exclamation points were true to what that patient included in their survey. So the whole experience was very rewarding. Thank you so very much. And then another in reference to the coupons and using them at the available outlets. "The coupons are great. I go every week and ask them specifically when this particular vegetable is coming in." The next slide. So outside of the Southwest Virginia Produce Prescription Program, each of our organizations has some ongoing food as medicine resources, programs, and services that are available. All of the ones you see here listed under Carilion can be found online. So if you want some more information, this is all publicly available with a quick Google search, and you can call or follow the links that you find online to get connected or to learn more. So one of the programs we have going on, in addition to produce prescription, we have other group health education classes and programs. So Full Plate Living is happening outside of the produce prescription program. We have a wonderful Healthy Hearts program, and then we have individual events like on food and mood and how what you eat affects your mental health. Morningside Urban Farm is another really wonderful resource if you're not familiar with it. It's located in Morningside Park in Southeast Roanoke, and it hosts free workshops for the community in the spring, summer, and fall. The events feature yoga, arts activities, and opportunities like gardening and farming, as well as educational classes on all kinds of topics. And the class participants can take home the fresh produce from the farm. We have community health workers on our team as well who work one-on-one with patients and community members to set goals and locate the community resources that are available to help them achieve those goals. And our healthcare practitioners can refer patients to community health workers. It's a free service. So for example, they might refer someone to a community health worker if the patient is experiencing food insecurity, and the community health worker can help them connect to resources. Finally, we have a lifestyle medicine clinic in Roanoke where patients can have one-on-one or group appointments with a lifestyle medicine practitioner, and that's to prevent, treat, or even reverse, in some cases, disease through lifestyle. And I'll pass it off to Sabrina and Maureen to talk about their services.
Thank you, Rachel. So our food pharmacy programs, we provide fresh produce for health and nutrition workshops, which Rachel touched on. We collaborate with them for those workshops. We have healthy and medically tailored food box delivery through home care food delivery programs. We also provide some healthy and medically tailored food boxes that are distributed on site for in-hospital and clinic distribution programs, as well as some pantries we have on site. For example, the Carilion Cancer Clinic has a pantry on site. And we also have some mobile health clinics where healthy and medically tailored food boxes are distributed at those sites. And then, our Hunger and Helpline, which I'm sure a lot of you are familiar with, we have provided the link so you can share that and have access to it. But that's made to provide to help, neighbors connect to food resources and community services in Southwest Virginia. And you can call, text, email, and go online for those resources. And I'll pass over to Maureen.
Thanks, Sabrina. So one thing that, to me, I really feel like the conversation is going full circle. So the reason that, as a community, we identified the produce prescription as a possible intervention back in 2015 to problems and challenges and opportunities in our community. And it really came from what community partners were already doing. And when we redesigned it, what we wanted to be able to do is to say, what are the existing partnerships and the existing resources in our community, and how do we tie them together? So SWPRx makes those explicit connections, and the partners also continue to provide resources ongoing. So sometimes there's critique of program interventions when it's a really short, intense duration, and then everything falls apart afterwards. So a lot of what we're doing through the SWPRx is also introducing people to community resources that will continue beyond the 6-month duration program. 6 months is not long enough to it's not going to solve all the problems. However, because it is intense and there's such a focus with really strong education and coupons for the food and fresh foods, people can explore without as much risk. And then how do they continue to maintain those really positive, healthy behavior changes ongoing? So Feeding Southwest has a lot of resources and they're integrated into the program. Carilion has a lot of resources and they're integrated into the program. And then LEAP, we also have resources that are integrated. So really trying to look at our whole community health, and how do we support not only these specific SWPRx patients for the long haul, but also the whole community. And so one thing that LEAP really found with our some of the early years when we were doing it with the mobile market is that the people who were introduced to the mobile market, they continued to shop at the mobile market, or they became regular, consistent shoppers at the farmers markets. And then anyone who accepted, participates in SNAP or WIC or Medicaid, LEAP has programs where fresh produce is half off. So it can just help address some of those barriers around affordability of food. And so LEAP continues to have all of our Harvest Bucks programs. And then during COVID in 2020, we also started a community produce program, which we continue to support as funding is available, where we purchase food from local and regional farmers and distribute it at no cost to community partners who then distribute it within the emergency feeding, whether it's Lion Share Food Pantry or the Community Solutions Center or West End Center. And then another really big aspect of our ongoing work in community is our mobile market, which prioritizes going to low-income senior housing sites, and then also sites, apartment complexes where there are a lot of immigrants and refugees, areas where it's hard for people to travel to find fresh food. They may not have vehicles. They may not have a full kitchen. They may be really interested and want fresh produce. So we come to them. And then at all of LEAP's outlets, we prioritize building community around food where it's a safe space to ask questions about what is this weird thing that I've never had? How do I cook it? And so there's really a community around exploring food together. And then at all of the outlets, including the mobile market, the LEAP community store, and the farmers markets, all of them provide the half off or the matching program for everyone who participates in SNAP, WIC, or Medicaid. So what does that ongoing community support look like? And then how do we continue to support local farmers and also make sure that anyone who wants to can have access to fresh, local, delicious food. So that's part of the reason why we are sharing, these ongoing resources, because a program is a snapshot in time, and it is a lot of resources and investment. And how do we really bring it together? And then the last thing that we wanted to share is there is also, if you are in Virginia, there is also a Virginia Food is Medicine Coalition. We will share out that one pager. There are a lot of communities and organizations that work in this space across Virginia. There are multiple produce prescription programs, multiple medically tailored meals and medically tailored groceries. And so how do we come together at a state level to advocate for ongoing support for food as medicine programs? Some states already have Medicaid 1115 waivers or in lieu of service waivers in order to allow Medicaid to reimburse for food. In Virginia, we don't have that. So we did in this most recent legislative cycle, we did put forward a bill and then also a budget amendment. Neither of them went through. However, there was a lot of interest at the state level. This is something that people are interested in and care about, and it's a really challenging budget climate right now, not just in Virginia, but nationally. And so how do we continue to work together to showcase the importance of food as medicine and the importance of produce prescription, and how we can really connect food and health more explicitly at the community level. So that's the end of our formal presentation. We went quickly, and there's a lot more we can talk about. I know that there's some questions. I will just leave our contact information up here for a minute, and then I'll stop sharing so that it's easier to see the screen and what's going on.
Great. Maureen, Sabrina, Rachel, thank you so much. This was really exciting to see, because I remember probably back in 2022, before you all had kind of repackaged this, I had just witnessing partners coming together to build this out, and it's really exciting to see what you all have accomplished over the last few years and more. There are a lot of folks with questions in the chat, so I'm going to just go ahead and start uplifting some of those. One is from David. He asks, are there HIPAA compliance issues for the participating food pantry? And I'll leave that, maybe Sabrina, or if you have a response there.
The food pantry that partners and helps support the program, they are not working hands-on with the patients. They are the food resourcing, so they're helping order, pick up, and deliver the produce to the nutrition educators for the classes.
Okay. Great.
And on the healthcare side, we are not sharing any identifiable patient information with our partners. So we did separate things intentionally. So the referral is an internal referral within Carilion. Carillion's handling kind of the scheduling and the rosters and everything like that. And then the food partners are just the connection with the food. So there's no kind of patient identifiable information that's being shared.
Okay. And on that point of some of the staffing, there's a question from Maria about which organization the partnership calls to engage the participants, like with enrollment and details for the program. Like, so who's doing that participant engagement aspect, and how is that structured and funded?
Yeah, good question. So the relationship with the participant is held by Carilion. So within Carilion Community Health and Outreach, there is a team of health educators, nurses, community health workers. They're the ones who are working directly with the patient. So once that referral comes through, it comes through to Carilion Community Health and Outreach. And we currently have nursing staff who are processing the referral. So they're calling the patients, they're documenting the outcomes. And part of the nursing staff is funded by the grant, but the grant is not large enough to cover all of the staffing needs. So some of that is also provided in kind, and that's through our community benefit dollars. I do know some organizations it doesn't have to be a nurse. There are other organizations who do produce prescription or other food as medicine programs, and they have like a food access navigator, but it's some kind of patient navigator who can document in the medical records so they can process the referrals, they can document the outcomes of the referrals. Did I answer everything?
Yeah, I think so. Thanks, Rachel. Okay, we have another question from Anita. How do you recruit farmers to provide the fruits and vegetables? Then how did you connect them with the healthcare providers that are participating? So, Maureen, you might be on that one, and I'm sure other folks have something to share there too. But the produce that was developed, what was the recruitment and engagement with farmers in the region around that?
Yeah, thank you for that question. So LEAP has been working in Roanoke for since 2009, really building relationships with farmers. And so when we started in Roanoke, it was pretty easy to reach out to the farmers markets that we've been working with collaboratively for years, and ask them to accept the produce prescription coupons. And then when we move to other communities, it's a lot of looking for what are possible partners, who are possible partners, asking other people if they know independent, locally owned places that might be interested in accepting it, and then having conversations and building that out. So a lot of the outlets participate in Virginia Fresh Match, but not all of them. So Virginia Fresh Match is the statewide network of outlets that accept SNAP and then provide that half off. So if they already participate in Virginia Fresh Match, then it was a pretty easy conversation. If they hadn't participated in Virginia Fresh Match, then we just have a couple of conversations. So we have mobile markets, large format grocery stores, farm stands, and then the farmers markets. Those are the big, most general categories. So last year, I think we had 20 outlets across the region where people could use the coupons. We wanted to provide a wide range of options. Some people prefer more of a grocery store type format, and some prefer more of a farmer's market. And also people had the opportunity to try out something that they'd never tried before. And so as we expand to new areas, we are continuing to build those relationships.
Okay. And along those lines, how can vendors at local markets, like within the Roanoke region, become available to take the produce prescription coupons and how might they be reimbursed?
Yeah, so the way that so any market, we've been working with the market managers, and then the market managers work with all their vendors. So if your market doesn't accept them yet, you can just ask your market manager to reach out to Leap. You can reach out. They can reach out to me, or they can reach out to Connie. Kenny's the person on our team who's been working with all of the farmers markets in our area. And then once a market signs on them, vendors, any farmer can also choose to accept them. And then they get reimbursed on a monthly basis.
Okay. Thanks, Maureen. And I know, Rachel, Sabrina, if you all have anything you'd like to add there around engagement with farmers and being able to use the coupons, I'll open it up too. Okay, great. So we'll go on to the next question, and this might be for you, Rachel, around Dee's interested in that role of the nutrition educator and lifestyle medicine as a community health worker. What organization are they related to? And like if somebody was interested in, participating or applying to a job or getting involved somehow, who would they contact?
Yes, so Dee, I'm so glad you asked. We actually currently have several open positions, one as a full-time community health worker with our Healthy Hearts program. And the others are as flex instructors who, so it's not full-time, but teaching like specific classes for produce prescription. So I can find the links to those.
Okay.
And put them in the chat. And so it's, if you're interested, you can read the application and apply through Carilion. And there's likely contact information on the job posting. I would go through there.
Okay,
Yeah.
great. That's awesome. Thanks, Rachel. So we'll be getting those links from Rachel with more specifics on that. Jessica's wondering, are there any plans to expand this to traditional private-owned healthcare so that it may be available for more folks?
Yeah, so I would say that a lot of healthcare plans have food benefits that may be built into their program. And the distinction between a private health plan and a Medicaid health plan is the funding source. So there may be private health plans that already have some sort of program, and they may already do this. Have some sort of food benefit program, and that's really at the private health plan's discretion. So we are focused on Medicaid patients in part because, well, for a number of reasons, but specifically who are the populations with highest need and oftentimes fewest resources. And it's a different policy approach if you're looking at Medicaid versus the private healthcare plans. There are some Medicaid plans that have these for their specific Medicaid population. And if there is a return on the investment, so if the investment in food as medicine pays off because it's lower cost long term, then they may decide to do that regardless of any other type of reimbursement. And so I think that space, there's a lot of potential, and it's really case by case. Whereas if it's Medicaid at the state level, then the math is just a little bit different. So don't know if that answers it specifically, or I would say insurance is not straightforward.
Thanks, Maureen. Anyone else like to add in that one before we hop to the next one? Okay, great. So John's wondering, will the statewide resource you mentioned identify others in different regions whom folks on the call who might be outside our region might be able to collaborate with? They're in Richmond and wanting to connect with other people doing this work. And some lovely folks in our space here have added some key organizations, but I did want to lift that up with that statewide resource if there are ways to know who else is doing this in the region. And I think this might have been the document you mentioned, right, Maureen? I put a link in the chat, the Virginia Food is Medicine one pager.
Yeah, so since, well, there isn't a statewide list of partners who are doing this, a lot of who we have found out are doing food as medicine programs have it's really been by word of mouth, or we've met each other at different conferences, or somebody knows somebody is doing something. So there is a coalition. You can send me an email and we'll add you to the email list. We have over 100 different partners across the state, and we're really just building the shared conversation around food as medicine. And within that, there may be people in your community who are already active in this space, or there may be people who are curious about it and would be interested in joining forces. At this point, there isn't a statewide, we're building the statewide connection and resources.
Okay, nice. Adrian was wondering from the results, the patients seem to have a lot of success related to their group experience, and was wondering like if Carilion partners with other like local folks who are doing education and other organizations like that support lifestyle changes on a local level, how that works, if there are any partnering organizations that help with some of that skill building within the lifestyle space.
I would say we are very much open to exploring partnerships and working with community partners. So I'm happy to make connections or have an initial conversation. I do know we have a practitioner who's interested in doing more around culinary medicine and things like that. So I don't know how well I'm answering your question, but open to having more conversations, absolutely.
Okay, nice. And just real quick, logistical, was wondering, Maureen, if you'd be willing to put up the contact info on the slide or copy and paste that information in the chat, just so folks can be in touch with you. And then we have another question here from Kim as well. And actually, I'm going to hold because I know, Maureen, you probably will respond to this and you're doing that. But I'll move to this question and I'll come back to that one. So Maria's wondering, what motivates Carilion leadership to support this work at this level? This type of investment in food as medicine work within a hospital is uncommon. Knowing their why would be valuable. If they see the return on investments and they're ahead of the curve, what motivates them?
So a couple of things, Maria. The first is, every 3 years, Carilion and any nonprofit health system completes community health assessments to identify top needs in their communities. And so we have top needs across the board for all 6 of our hospitals related to diet-related chronic disease and healthy food access. So starting back in 2015, when those needs were identified, that's when we started the pilots. I would say, though, to scale, the grant was really necessary and important. Food is expensive, staffing is expensive, all of the things. So grant funding can really help. And our hope is by the end of this grant funding, we have a path forward for sustainability financially and process and systems wise as well. So we've got a little bit of time to figure that out. But I would say the scale of the current program would not be possible without the grant funding that we have now.
Rachel, can you give us a refresh on what that grant is again?
Yes, so it's a USDA, so Department of Agriculture, GUSNIP. Oh gosh, you're testing me now. It's Gus
I
Shoemaker Nutrition Incentive Program, and there are a couple of tracks. So we are on the produce prescription track. So Gus
Yes.
NIP produce
Gus
prescription
NIP.
through
NIP.
USDA. Yeah.
Okay, I'm gonna put a link in the chat for folks.
Oh, that's a good
I just
idea.
found it in Google. Let's see. Okay, this one, what are the best non-perishable foods in terms of food as medicine? And are these items well received at food pantries. And I guess maybe Dee's wondering about like if I'm wondering if it's non-perishable produce, or I guess are there other things other than produce that you all are offering within the Food is Medicine program that are non-perishable?
Do you mean specific to this the produce prescription program or food is medicine in general? So
What are the
if
best in terms of food as medicine? Yeah,
so
let's say food as medicine more broadly.
So yes, there's non-perishable, there's shelf-stable items, a lot of the where we say medically tailored or healthy choice, we're looking at the no salt added, low sodium shelf-stable items like that. Those healthy choice boxes. It's not just fresh produce, there's non-perishable, healthier choice items that are provided, yes. And with our produce prescription program, it is fruits and vegetables.
Okay. And as a
Mhm.
follow-up, are there kind of considerations around carbohydrate, sugar, alcohol, caffeine? Like it seems like there are these different aspects of a diet that would be beneficial for folks experiencing diabetes, and it's pretty tailored and specific.
Yes, there are several different boxes of available that you can get. There are diabetic friendly. There's two different healthy choice boxes. There's healthy heart. They all are healthier, but they do get specific. And of course, all the nutrition educators that are working along, help with providing recipes with those items and so forth. But yeah, there are shelf stable non-perishable items that are focused to those chronic illnesses and so forth. And they are well received at the pantries. A lot of the pantries, that are are a part of the Healthy Pantry Initiative. They go with feedback that they get from their neighbors that visit the pantries and what they're looking for. So they're able to get those items in and please the neighbors on what they're looking for to take
Okay.
home with them on the healthier side. Yeah.
Awesome. And this is kind of related. Ben's wondering, do you all partner with organizations that support homebound patient support, like Meals on Wheels, Project Angel, God's Love We Deliver? He's just wondering because he volunteers with some of those programs and was wondering if some of these produce prescription options are available for homebound support.
So currently, the Southwest Virginia produce prescription program does not have like a food delivery component, but I know within the food is medicine space, there are some creative ways different partners are doing food delivery. So I don't know, maybe Sabrina, you can speak to that more.
Yeah, that's correct, Rachel. Yeah, we do have some home care programs that we support that are able to, when they're going to these patients' homes for the medical visit, they are taking these medically tailored boxes with them and providing them for the patient.
Okay. Nice. So more broadly, food as medicine is definitely available homebound. The produce prescription, not yet. Okay.
Correct.
Awesome. And then we have a question from Kim, wondering about the outlets for the produce that you all are incorporating into the program. Do they have to procure like locally or regionally sourced produce? Are you working specifically with that, or do you also have more large scale industrial supply of produce? What is the percentage breakdown between local, regional, and non-local regional?
Our priority is on locally owned businesses, many of which source locally, and we have a preference for that, but it's not a requirement. We are focused on making sure that there is a quantity, that there's always enough produce stocked, because this specifically produce prescription is just for fresh foods, fresh fruits and vegetables. And so we want to make sure that whoever is working on the produce coupon aspect of it, that they have enough produce. And we continue to find that, really investing in locally owned retail outlets, they are also committed to the local community, so it is being reinvested. However, it is something we're happy to support with on the sourcing side, but it's not an explicit requirement. That's the space that we have found.
Great. And I think this might be a good clarifying question to end with. Is Food is Medicine a program name or just the title of our talk today, or is this something more broadly understood as a field?
Yeah, I spoke to that at the front end. But the food is medicine, food as medicine. They are, I would say, ideas. They are not clearly defined. They can be used to both as a marketing um, pitch and also as a collection of more specific interventions. The most common food as medicine interventions are produce prescription, medically tailored meals, and medically tailored groceries. It still is a relatively new space, and so there are different national collaboratives that are working through what the different definitions are. We are using the food as medicine language because that is part of the national conversation, and we really were focused specifically on the Southwest Produce Prescription Program for this. And it is a subset of all of the work that we're collectively doing around how do we connect health and food.
Okay. Yeah, that's helpful. I'm remembering that pyramid you had at the beginning of the call. And so some folks may have hopped on later, but if you want to rewatch that, Maureen outlined that with the image and the figure there earlier in the presentation too. But it's helpful to know that this is a convening idea, not necessarily a field, because it operates within a lot of different fields, as we're seeing among the partnerships that are present at the table that you all represent. And I would just uh, end by just commending you all. Like, it's just so lovely to see the organizations and that you represent coming together in this really coordinated way to provide a program that's really beneficial to many people and really changing day-to-day lives for folks and making impact. So it's really exciting to see that work on the ground, especially when we're exploring food systems, right? To be able to see what one potential project can do and the ripple effects of that. So I really appreciate you all taking your time today to share, and want to encourage folks. We have a survey in the chat, and I'll put that back in there again. We'd love to hear from you how your experience today in the program, maybe anything else you'd like to hear about within our community. But otherwise, we will share this recording out so you can share with other people or also reference yourself. But really appreciate your time, and invite any folks to share comments in the chat, or you're welcome to come off mute and say goodbye so our speakers can hear you, and you're welcome to share your thanks along with me as we close out here. But thank you all so much. Appreciate your time. I love all our engaging questions. It's not common that happens. There we go. Awesome. Yay!
Did you end the recording?
I will now. Let's stop it. There we go.